What if there were real ways to slow down glaucoma without needing surgery or lasers? Just practical, proven habits you could start applying right from home. It might sound overly simple at first, but growing research suggests that certain lifestyle changes and natural glaucoma remedies can help reduce eye pressure and protect your vision over time. Glaucoma is often called the silent thief of sight because it can progress with little to no warning. While eye drops, surgery, and other traditional treatments do exist, they aren't perfect, and they're definitely not the only tools available. This raises an important question. Could lifestyle changes really help prevent vision loss and lower the need for invasive procedures? That's exactly what we're going to explore. Over the next few minutes, you'll discover 7 practical science-supported tips for managing glaucoma without surgery. These aren't just theories, they're realistic actions you can begin today. And when we get to tip number 5, you might be surprised, because it's something most people never think about, yet it could make all the difference. Tip 1. Use prescription eye drops consistently. Let's begin with something that seems simple, yet many people still overlook it: using your glaucoma eye drops consistently, every single day. If your doctor gave you a prescription and it's now collecting dust in a bathroom drawer, it's time to rethink that routine. That tiny bottle may not seem like much, but it's often your first and most effective defense against vision loss. Medications like prostaglandin analogs or beta blockers work behind the scenes to reduce pressure in the eye and help protect the optic nerve from further damage. The challenge is, you don't feel any immediate difference after using the drops, so it's easy to forget or skip a dose here and there. But that's risky. According to research published in Ophthalmology, patients who used their drops as prescribed saw a 58% lower risk of vision decline over 5 years. That's a significant number. To stay on track, try placing a drop chart somewhere visible, or set a reminder on your phone with a message that grabs your attention, something like, "Time to protect your sight." And if the drops cause discomfort or redness, don't stop using them without talking to your doctor. There are often alternative medications that can work better for you. Think of it like brushing your teeth. You do it daily without thinking, because it's essential. The same goes for glaucoma treatment. Consistency matters. Once this habit is locked in, managing the rest of your eye health becomes much more straightforward. Tip 2. Follow a nutrient-rich diet for eye health. Believe it or not, what's on your plate could be quietly shaping how well you see, especially when it comes to managing glaucoma. After 60, your eyes face constant pressure from oxidative stress and inflammation, and the right nutrients can either fight back or let the damage continue. A strong diet isn't just good for your body, it's essential for your vision too. Start with greens: spinach, kale, collard greens. They're loaded with lutein and zeaxanthin, 2 powerful antioxidants that help shield your eyes from harmful light and support your optic nerve. In fact, research has shown that diets rich in leafy greens may reduce the risk of developing glaucoma by up to 30%. That's not hype, it's real data. Next, go for color. Carrots, sweet potatoes, and squash provide beta-carotene, which your body turns into vitamin A, key for healthy vision. Cold water fish like salmon or sardines add omega-3s that reduce inflammation and may help with eye pressure control. If fish isn't your thing, a high-quality fish oil supplement can be a solid alternative. Just check with your doctor first. For drinks, green tea is an excellent choice. It's rich in antioxidants that support long-term vision health, especially as you age. Just 1 or 2 cups a day can make a difference. And don't forget citrus fruits like oranges and grapefruits for a natural dose of vitamin C, which helps keep blood vessels in the eyes strong and flexible. Now, this isn't a replacement for glaucoma eye drops, but it gives your body the nutrients it needs to support your treatment plan. Think of nutrition as the foundation for every other step you're taking. And once your diet is working for your eyes, the next priority is keeping a close watch on something even more direct: your eye pressure. Tip 3. Monitor eye pressure regularly. You might be following your routine, taking your glaucoma eye drops, eating well, maybe even enjoying that daily cup of green tea, but if you're not keeping an eye on your intraocular pressure, you're missing a crucial part of the picture. Eye pressure can rise quietly, and without regular monitoring, it can start damaging the optic nerve long before any symptoms appear. That's what makes glaucoma so tricky. It progresses silently. If you've already been diagnosed, getting your eye pressure checked every 3 to 6 months is essential. And if you're considered at risk, say a family history of glaucoma or early warning signs, then yearly checks are the minimum. Think of it the same way you monitor blood pressure or glucose. It's a number that gives you power over your health. When you know where you stand, you and your doctor can make smarter decisions. And for those who prefer fewer trips to the clinic, home monitoring is now an option. Devices like the FDA-approved iCare Home Tonometer let you track your eye pressure from the comfort of home. It's an incredibly useful tool, especially for adjusting your glaucoma treatment or tracking how lifestyle changes are working. Once pressure is being tracked regularly, the next step is finding natural ways to help lower it, and one of the most effective approaches starts with movement. Tip 4. Practice safe, low-impact exercise. Let's talk about movement, because when it comes to glaucoma, you don't need intense workouts to make a difference. Gentle, consistent activity can do wonders for supporting eye pressure control and protecting your optic nerve. In fact, studies have shown that moderate aerobic exercise, like walking, can lower intraocular pressure by as much as 20%, all without medication. The key is to stick with low-impact options that raise your heart rate without putting stress on your eyes. A brisk 30-minute walk each day is a great place to start. You can also try water aerobics, ride a stationary bike, or explore something slower and more focused like Tai Chi or gentle yoga. These exercises boost circulation, calm your nervous system, and support long-term vision health. And if you do it with a friend, it's not just good for your eyes, it becomes something to look forward to. It's worth noting that some forms of exercise can actually raise eye pressure, especially those involving inversion or strain. Movements like headstands, downward dog, or heavy lifting while holding your breath should be avoided. That kind of pressure spike isn't helpful when managing glaucoma. If you're ever unsure about a new activity, just check in with your doctor to be safe. Physical movement isn't only about staying fit, it's part of a broader strategy to prevent vision loss and support your overall glaucoma treatment. And while you're keeping your body active, don't forget there's another area of care that's just as important: protecting your eyes from external threats like trauma and bright light. Tip 5. Protect your eyes from trauma and bright light. Here's something that often gets overlooked. Even small injuries or overexposure to sunlight can seriously disrupt your glaucoma treatment. A minor scratch, a bump, or too much glare can trigger inflammation that raises intraocular pressure, something you definitely want to avoid when managing this condition. It may not feel like much in the moment, but over time, these incidents can quietly accelerate vision loss. That's why eye protection is so important. Anytime you're outside, wear sunglasses that block 100% of UVA and UVB rays. Not just stylish shades, but real protective lenses. They help preserve your optic nerve and reduce the strain from harsh light. And if you're doing any yard work, home repairs, or projects where dust or debris could hit your face, don't take chances. Put on safety goggles. One unexpected slip, and your eyes could pay the price. Think of it like wearing a helmet, just for your vision. Even daily activities like driving can expose your eyes to intense glare, especially during sunrise or sunset. Without protection, that repeated strain can add up. Taking these small steps consistently strengthens everything else you're doing, from using your glaucoma eye drops to following a vision-friendly diet. And now that your eyes are better protected from the outside, let's talk about how internal health conditions, like diabetes or high blood pressure, can quietly affect your eyes from within. Tip 6. Manage other health conditions. Here's something most people don't expect. Glaucoma rarely shows up alone. It often comes bundled with other health issues like diabetes, high blood pressure, and sleep apnea. These conditions might seem unrelated, but they can quietly make glaucoma harder to control if left unmanaged. So even if you're taking your glaucoma eye drops and eating well, ignoring these underlying factors could slow your progress, or even reverse it. Each one poses its own risk. Diabetes can damage the small blood vessels in your retina, cutting off oxygen and raising pressure. High blood pressure leads to increased fluid buildup in the eye. And sleep apnea, which disrupts breathing during sleep, can starve the optic nerve of oxygen night after night. That's a dangerous combination, and it makes managing glaucoma more challenging if you're only treating it on the surface. To stay ahead of these risks, check your blood sugar regularly, keep your blood pressure under control, and if you struggle with heavy snoring or restless sleep, ask your doctor whether a CPAP machine might help. These steps might not seem connected to your eyes at first, but they're deeply linked. When you manage these conditions, you're not just improving your overall health, you're directly protecting your vision. A study in JAMA Ophthalmology even found that people with multiple chronic health issues saw glaucoma progress more rapidly, even under treatment. That makes it clear, comprehensive care matters. And while those are the big health concerns, there are also smaller everyday habits that could be doing more harm than you think. Tip 7. Avoid risk factors and harmful habits. You might not realize it, but some everyday habits, like that extra cup of strong coffee or wearing a tight necktie, could be subtly increasing your eye pressure. Over time, even small actions like these can interfere with your glaucoma treatment. Smoking, in particular, has a direct impact by restricting blood flow to the optic nerve, which can accelerate vision loss if left unchecked. And habits like holding your breath while lifting heavy objects can cause internal pressure spikes that affect your eyes too. The good news is, small changes make a big difference. Try to limit caffeine to just 1 or 2 cups a day, and if possible, switch to green tea. It offers antioxidants that support vision health, especially as we age. If you're a smoker, quitting is one of the most important steps you can take for your overall health and your eyesight. Tools like nicotine patches, support groups, or mobile apps like Quit Now or Smoke Free can really help. Posture and positioning matter too. Sleeping flat or with your head lower than your body can raise eye pressure overnight, so use an extra pillow to keep your head slightly elevated. Even how you breathe, sit, and move throughout the day plays a role. These adjustments may seem small, but together, they can help prevent unnecessary pressure and keep your glaucoma more stable. A long-term study known as the Beaver Dam Eye Study found that smokers were up to 3 times more likely to develop glaucoma, especially in older adults. That's not to alarm you, but to remind you that simple lifestyle shifts can give you more control than you might think. And when you've taken care of these risk factors, you've cleared the way for something even more powerful, a mindset that ties everything together. Now you've seen it, managing glaucoma doesn't have to mean surgery, and it never did. With consistent habits, smarter daily choices, and a bit of intention, it's not just possible to protect your vision, it's powerful. So here's what matters now. Which of these 7 tips are you ready to put into action? Are you staying consistent with your drops? Adjusting your diet? Or maybe it's time to let go of a few harmful habits that have slipped into your routine. I'd love to hear what stood out to you most. Share your thoughts in the comments below. I truly read every one. And if this video made a difference for you, it could do the same for someone else. So take a second to like it, share it with a friend or loved one, and be sure to subscribe to the channel. Don't forget to turn on notifications so you don't miss out on future videos that could help you stay sharp, healthy, and independent. And before you go, keep the momentum going. There's another video waiting for you right on the screen, filled with more practical tips to help you live well and take full control of your health.